Hello again. This is Jessica Holkeen. Um, just a continuation of the slide that I had done previously, which was implications of poor application of effective communication. So, some contributing factors to poor application. So, the inability to actually provide effective communication in the work setting specifically, which would be like a hospital, acute care setting, anywhere that nurses are, since we are in the nursing program, that's what I'm specifically referring to here, um, can be contributed by intimidation by the physician or even senior nurses. So let's say a new grad nurse coming on to her first shift after her orientation, she's going to feel possibly a little bit less competent than the other nurses who have already been doing this for a much more longer time than they have. It is a very scary world out there, and a new nurse is apprehensive, especially on their first shift, and they might not be able to effectively communicate SBAR during handoff or over the phone to a physician. And even during new grad orientation, this is also possible. Feeling intimidated by the physician or by senior nurses doesn't allow for effective communication. Bullying. Bullying is a major contributing factor. Nurses could either be making fun of them or be mimicking the way that they talk to the physician over the phone, um, or by making a mistake that they made over the phone while they were doing some type of SBAR can result in lack of confidence, therefore leading to a less effective communication and not getting the point across like they need to for the safety of the patient. A toxic work environment, again, will cause will wreak havoc and will cause more less of a less effective communication. It can still allow for communication, but it's not going to be as effective, and it's going to result those um, in those long lasting adverse effects events that I mentioned in the previous slide. Fear of embarrassment is a huge one as well. Nurses don't want to be called out, and especially new grads or new nurses or somebody just new to even the work environment, a new hire from a different hospital, it's still the same thing. They don't want to feel embarrassed, and therefore they may not ask the questions that they need to or effectively communicate like they should be, especially during SBARs and handoffs, especially when you need to be effectively communicating for the safety of your patient. Unsafe nurse to patient ratios can also allow for lack of the communication because you don't have the time to effectively communicate with another nurse. You're rushing with the heavy assignments that you can have and going back and forth to different patient rooms. Therefore, it has to be a quick report, and you may miss some things in your handoff that can again reduce the safety to the patient, which can result in an adverse event. Cultural barriers, if you can't understand the other nurse or the other peer or the other physician, whoever it may be, if they speak a different language than you and have a heavier accent, it may be very difficult for you to understand them. Or if English isn't your first language and you're working here in the United States, you may have some difficulty understanding somebody else who speaks English. Cultural barriers are a big one as well. And lastly, but not least, fatigue and burnout. If the patient or if the nurse is tired, for example, when they're coming off of their shift and they are just ready to go home, they worked 12 hours, it was a heavy assignment, and then they may just be so tired and fatigued that they're not, their brain isn't working as effectively as it would. It's not, it's going to result in ineffective communication and therefore poor application of effective ineffective communication.